Everyone, I'm Dr. Lisa Palmer, coming to you live from Palmer Natural Health on female health. We've been getting a lot of female health questions, and so I wanted to come to you live on the topic of female health. There is so much misinformation on female health, so let me know you can see me, let me know you can hear me. You can ask me whatever you want to ask me in the chat specifically tonight, or if you have other female health questions. I want to talk about endometriosis. A lot of women suffer from endometriosis, a thickening of the uterine wall, PCOS, polycystic ovarian syndrome, and infertility. I'm Dr. Lisa Palmer, owner and head physician at Palmer Natural Health. We're located in Central Florida. We serve our patients through natural healthcare means by quantum nutrition, chiropractic, and a lot of education. That's why we go live every single week on various different topics, because we want to help you guys with your health. And so I've seen a lot of women lately. So again, if you guys can hear me okay. Hi, Marion. If you guys can hear me, let me know. Say hello where you're from. We serve patients locally in Central Florida, and we have clients all over the world, as far as Australia, California, New York, Texas, Nebraska, Indiana, Ohio, Iowa, you name it. We're in many, many states. I don't know if there's a state. I don't think we have a New Hampshire patient. So if you're from New Hampshire, I'd love to help you. Ocala, you're really close to us. So Marion, I don't know if you come see us, but Ocala, we consider you a local. And so lately I've seen a lot of women with weird abdominal pain, cramping pain. I had a patient earlier this week was in so much pain. She was like, I don't know if I should go to the emergency room. I'm not sure if I have appendicitis, if I have ovarian cyst that is rupturing. She was in extreme pain. She was in tears. She, was debating emergency room, CS. What should I do? Utilizing quantum nutrition testing, we feel like health detectives. We're able to dig is not a good word. We're able to look into causes of why someone's having a symptom. If you're having a symptom, if you're diagnosed with something female related, my opinion, the solution is not hormones, right? So our female bodies make estrogen, we make progesterone, we make testosterone too, ladies. And when you give your body a hormone, your body will naturally make less natural production of that hormone will go down. So if you have low progesterone and you take progesterone, it's called a negative feedback loop or a positive feedback loop, your body will make less progesterone. If you have high estrogen, there's medications you can take that block your estrogen. But we would want to find out why you have high estrogen, because high estrogen can lead to cancer, ovarian cancer, cervical cancer, breast cancer. Female bodies don't like too much estrogen. Male bodies don't like too much estrogen. I was working with a patient earlier this week. He's a man and he has high estrogen levels. What would cause high estrogen in a man? Being exposed to plant-based estrogens. So plastics can raise estrogens in women and men. That's what's called dirty estrogen. Consumption of soy can increase estrogens. Hi, Janice. Good to see you. If you're on, say hello. I'd love to say hi. Ask me a few more questions. And so endometriosis is a thickening of the uterine wall, right? The uterine wall thickens. If you have endometriosis, it means that your hormones are not balanced. You can't have endometriosis with balanced hormones. And so they may put you on birth control. There is a new documentary out called The Business of Birth Control. I advise everyone to watch it. It talks about how birth control was fast-tracked by the pharmaceutical industry to make money, and how every single birth control has side effects. Cervical cancer, breast cancer, ovarian cancer, infertility. When I have patients that have infertility, The ones that have a really hard time are the ones that have been on birth control of some kind, whether oral birth control, the patch, or IUD, intrauterine device, where they put a device in your uterus. Those are the cases that have a hard time with fertility. Why? Because birth control blocks your hormones. It causes imbalanced hormones. I shouldn't say blocks. It imbalances your hormones. And so you don't even have a period. The bleed is a breakthrough bleed. It's not even a period. And so not having your period for a really long time is not healthy for a female body. I had a patient, she was in her 30s when I got her. She got put on birth control when she was like 15 or 16, and she had issues with fertility. And I was working with her and she was improving on her program. And then all of a sudden she disappeared. And I was like, my front desk kept trying to call her. I was calling her. I was emailing her. And I was really worried about her because she wasn't the kind of person to just fall off the face of the earth. And so finally, I don't even remember how many months later, finally she came back on my schedule. Finally, we got a hold of her. And I was like, where have you been? Like, I've been trying to get a hold of you. I was worried about you. And so, like, if you're our patient and you don't call us back or you kind of disappear, we worry about you. So, send an email, send a text, let us know you're okay, you're just busy or whatever. So she goes, Dr. Palmer, I was hospitalized. I'm like, you're 30 something years old. Why were you hospitalized? She had a stroke in her 30s. Why did she have a stroke? Well, when you're on birth control for a long period of time, it increases your risk of blood clots. People don't talk about that. And so one of the worst birth controls that was out there was Yaz. I don't know if any of you guys were on Yaz. And Yaz was recalled. I think Yaz has many lawsuits as well, for causing blood clots. And so young women be put on Yaz for birth control, and they would have strokes or heart attacks. So a blood clot to the brain is a stroke. A blood clot to the heart is a heart attack. And so in the business of birth control, there is a scene where a young woman is out with her friends and she just doesn't feel good. And she ends up having a heart attack and passing away from a blood clot in her heart. That's awful. That is not good, right? And so I tell my patients, medications come with a price. Birth control comes with a price. Hormones come with a price. And every single medication, whether it is birth control, hormones, hi Rachel, birth control, hormones, bioidentical hormones, whatever, has a side effect. And so these poor women with endometriosis, they get put on birth control to try to help regulate their cycles. Women with heavy periods, cramping periods. So many women I know, they're like, well, around my period, I was just talking to a patient today, one of her coworkers, her period is so bad that like 2 days in her period, she has to stay home because she has such intense cramps. You're not supposed to have cramps like that. That's horrible. You're supposed to have cramps at all. I don't have cramps, right? Why? Because I've been working on balancing my hormones naturally by detoxing out chemicals. Where do you get chemicals from? The air we breathe, the water we drink, the food we eat, heavy metals. Back about 15 years ago, yeah, I'd say about 12, 13 years ago, I had really bad periods. And bad periods meaning I didn't have a normal menstrual cycle. I would have a period, skip a month, have a period, skip 3 months, have a period, skip 5 months. I never knew when I was going to have my period. And that's really bad, right? And so I went to my OBGYN and I said, look, I have irregular periods. I play soccer. I played soccer since I was in high school. I ran track. I played volleyball. I played professional women's football. I rode crew in college, and so they're like, oh, well, you're an athlete and you can have athletic amenorrhea. What does that mean? It means that because you're so active, your body fat can go down and you can skip your period. No, it meant that as an athlete, I worked out really hard. Sometimes I reduced my calories too much. And a lot of times I eat crappy food, right? So I think a lot of athletes, and you guys can let me know if you've ever had this viewpoint, is at least my viewpoint was I can eat whatever I want. So I'll try to eat healthy sometimes, but I can eat pizza. So I remember in high school, my favorite lunch in high school was, it was so trendy. Pizza Hut would sell pizza in our cafeteria. And when you bought pizza, you could get a soda for like $1 or something like that. So I get pizza, I would have soda, and then my the cafeteria ladies, oh my gosh, they made these like big chocolate chips. You have to let me know. Hey Jamie, you have to let me know if your cafeteria ladies made these huge chocolate chip cookies that were soft and chewy and awesome. Hey Jamie, I met some like Adam guy, by the way. And so, yeah. And so I ate crappy food when I was in high school. Why? Because I was an athlete and I went to soccer practice every single day in Miami, and, Monday through Friday after school. And I ran my butt off. And I thought, okay, if you look good on the outside, it doesn't matter what you eat on the inside. And actually, I was taught that high carbs as an athlete was good. So I was like, okay, what's got carbs? Pizza has carbs, cookies have carbs, soda has carbs. This is perfect before soccer. And you know what? It was not perfect before soccer because all that sugar and carbs running in my stomach in the Miami heat, I felt horrible. I actually did much better when I ate protein. So I had some kind of meat, chicken, fish, steak, whatever, and some veggies, right? I probably would have done better on carnivore. I felt like crap when I had pizza and cookies and Pepsi, and I thought that was like what you should eat. I was taught as an athlete to carb load, and when I carb loaded, I felt like crap, and I didn't feel good on the field, right? I felt heavy on the field. And so if I could go back and tell my younger self what I know now, would I listen? I would hope I would listen to myself, but I don't know. Would you listen to yourself? And so I had irregular periods, and I went to my OBGYN and I said, hey, look, I have a period, skip a month, have a period, skip 3 months. I never know when my period's coming. And so she did an exam on me. She did blood work. She listened to my heart. She looked in my female parts. And guess what she said? She says, you're healthy. You're an athlete. You're healthy. And in fact, you have nothing going on and you're wasting my time. She also, because I was in college at the time, she also did HIV test on me. And so I hate when they put you in the room and they make you wait, right? So I really try hard. If you're a local patient, we really try hard to process people on time. If you're a telehealth patient, we really try hard to process people on time as close to your appointment as we can. Sometimes we have crazy emergencies. This Monday, I had an emergency little kid patient that was in the emergency room and came to see me. So, we try the best we can to stay on time. Sometimes we can't. I had a woman that was irritated with me today, and she's like, and one time your staff was 10 minutes late. I'm like, are you kidding me? Like, we're doing pretty good. If we were 10 minutes late, we're doing pretty good. When my husband was having heart issues, we waited for the cardiologist 5 hours. I'm not saying it's right. Waited for him 5 hours, still wasn't seen, and we got pushed to the next morning. It was insane. So she puts me in this little room and makes me wait for my HIV test because I'm a college student and they scan all college students for HIV. And I'm sitting there and I'm sitting there and I'm sitting there, and it feels like a really, really long time has gone by. So finally, I'm sitting in the room with the door closed, right? Finally, I open the door to the treatment room and I look down the hallway and there's a nurse and she's like eating French fries and typing her notes. And it kind of feels like everybody's at lunch. It feels like that nurse is the only person left in this department. And oh, by the way, this department was I don't want to say what it was, but I guess I should start. It's a medical school in South Florida, right? And they're pretty famous, but I won't throw them under the bus because it wasn't the school's fault. So anyway, so finally I leave the little room and I'm like, hey, and she looks at me like she's seen a ghost. She's like, oh, you're still here? And I'm like, yeah, I've been waiting forever for the doctor to come see me because she has my blood tests and I'm really getting nervous because it's supposed to be my HIV test, and I don't have HIV, so I'm not quite sure why they ran that, but they ran it, and I'm really nervous because it's been a really long time. And she looked at me, she's like, "You're still here?" And I could tell they're all at lunch, right? I'm not a moron. She goes, "Oh, well, Dr. So and so is at lunch." And I'm like, "Okay, well, does she have the results?" She goes, "Okay, let me call." And I can tell like the doctor's kind of freaking out because she forgot I was in the exam room and totally went to lunch and left me there. And so the nurse is like, "Okay, well, doc kind of remembers they lost your blood work, and she remembers that you're negative. She thinks you're negative." And I'm like, "Are you kidding me?" Like, I'm sitting, and I'm a kid, I'm like early 20s. And I'm like, "She thinks that she remembers? Are you kidding me?" And she goes, "Yeah." And she says you're healthy, and you don't need to come back ever. I'm like, "What? Like, what is that?" So I have irregular periods. You don't know why. I'm wasting your time. You lose my blood work. You think I'm negative. What a freaking mess, right? And my office isn't perfect. We've made mistakes. We've left people in the lobby. We've skipped over appointments. I forgot to call a patient yesterday. It was so embarrassing. I'm like, "Oh my gosh, I'm so sorry. I totally like overlooked this appointment." And my patient, just honest, my patient understood. So like, if that doctor came back from lunch and said, "Look, Lisa, I'm so sorry. I totally forgot about you. I was starving and went to lunch. I'm so sorry. I apologize," I would have felt better about it. But never would I ever want to see that doctor again because she didn't apologize. She just kind of said, "Oh, I think it was this," and never come back. Like, that's crappy, right? And so my periods were always irregular. I never knew where they were coming. And it wasn't until I got into holistic nutrition and we did this weird muscle testing stuff, right? That I found there was a problem with the gland in my brain called the pituitary gland. Now, soccer players, we do this really weird thing. So, Jamie, I know your husband played soccer, which is so cool. And so, if anybody else on here played soccer, we do this weird thing in soccer called heading the ball. And it means you meet the ball with your forehead and you hit your head. You meet the ball and you hit the ball with your head, right? That's called heading the soccer ball. I'm laughing because you guys see one of my little kid patients gave me gold stars. And I realized that I still have them all over. So, if one of my patients says thank you and gives me gold stars, I'm going to keep them on. So, as a soccer player, when you head the ball, the bones in your skull actually can shift. And when they shift, you can actually irritate the gland in your brain, the center of your brain. It's so important. It has its own little kind of bony vault that it sits in, or it's called a sella turcica or Turkish saddle because it looks like a little kind of, I guess, like a reverse saddle. I don't know. And the pituitary gland is so important. It's protected by this in bony kind of saddle. And so my pituitary gland was not working well. And I think part of that was from playing soccer, and the bones in the head can shift and irritate that gland. So if you are a soccer player, especially a female soccer player, and you have hormonal issues, it could be from hitting the ball, the bones in your head shifted, and you need what we call cranial work. And so cranial work is you can work on, there's a suture here. If you touch the top of your head, there's a suture there where two of your bones, these are called parietal bones, came together. And they can shift. And when they shift, they can irritate the pituitary gland and cause female hormone issues. If you're a male soccer player and you had the ball, it also can cause problems to your pituitary gland. It can cause high estrogen or low testosterone or imbalanced hormones. So I'm not saying in every case, if you have hormonal issues, that you need cranial work. I'm just saying, hey, if you played soccer, football, ice hockey, rugby, I don't know, any sport, because a lot of sports are not contact sports, but they're really like basketball is a contact sport. Baseball could be a contact sport if you're sliding into home or sliding into first. And so that pituitary gland can get irritated. And in addition to that, I was testing nutritionally for a toxic metal. And that toxic metal was mercury. How did I get mercury? Well, I don't have any silver fillings. I was vaccinated as a kid. I only got 7 shots. The new schedule for kids right now is 74 shots. I had 7. They, between the ages of 0 and 18, it's 74. That is insane. And so I could have had mercury, because some shots do have mercury. I could have had mercury from consuming high fructose corn syrup. In the finishing step of high fructose corn syrup, you could have mercury. Mercury can get in there, or it could be added in there, or I don't know the manufacturing process. Where do you find high fructose corn syrup? You find it in sodas, cookies, candy, processed foods, alcohol, baby formula. To me, that is the most criminal place where they put high fructose corn syrup. Another word for high fructose corn syrup is corn sugar. Dirty stuff, not cool. So, yeah, I had mercury bothering my pituitary gland. So they didn't say, "Hey, we're gonna give you hormones," or "Hey, we're gonna stick this thing up your nose and pull any kind of tumor out of your pituitary gland." Instead, through whole food nutrition, I took a supplement that detoxes out mercury. And it wasn't just a random supplement that someone picked for me. It was a supplement that was tested for me based on what my body needs. And then I took a supplement for my pituitary gland to help give my pituitary gland nutrients to rebalance it out. And when I did that, my periods normalized for the first time in my whole entire life. So at this point, I'm in my 30s, irregular periods since I think I got my period at like 13 or 14, right? And I was like, oh my gosh, this is what normal periods are like. This is cool. I wasn't emotional before my periods anymore. My boobs didn't hurt, it was amazing. And so what we do with quantum nutrition testing is we look for the cause. So in my case, I had a heavy metal. In your case, you might have a chemical. You might have mold. You might have inhaled some weird chemicals in your job. You might have picked up a parasite. PCOS, or polycystic ovarian syndrome, means that the ovaries grow cysts. Why do they grow cysts? Do they think it's fun? No. The ovaries grow cysts because the hormones are in balance. Oftentimes, someone is in a high stress job where they have a highly stressful life. They have increased cortisol, which screws up the other female hormones. The body will release too many follicles, and those follicles can get on the ovaries and make cysts. When a cyst ruptures, it hurts like hell. If your female cycle is not working properly, you will not conceive, and that will lead to infertility. And so, infertility treatments in the medical world are cancer drugs or chemo drugs. There's a chemo drug they give for fertility because they found out that some women that were receiving chemo were getting pregnant. And I'm like, oh my goodness, so many words I could say that are not appropriate. And so they're giving this chemo drug for fertility. That is not how you want to get pregnant. Hey, Jessica. If you are having, it'll be a little blunt here, if you're having unprotected sex and you're not getting pregnant, you are infertile. Your system is not working right. I'm not saying that to be mean. I'm not saying that to be unkind. I'm not saying that to be whatever. That's just a fact, right? If you're having unprotected sex and you're not getting pregnant, it is because either you're past that, like you're past conception ages, right? And that's up for debate. What age is it? Is it 30? Is it 40? Is it 50? Is it like 60? I don't know. I would say somewhere in the 50s. I think JLo was like 50 when she got pregnant, right? Not that everything revolves around JLo, but so some women come to me in their 30s and they want to get pregnant. They think they're too old. You're not too old in your 30s. We just got to get your body balance. You're not too old in your 40s. We just got to get your body balance. In your 50s, you're pushing the envelope a little bit, but could you get pregnant? Yeah, you could, as long as you haven't gone through menopause. And menopause doesn't mean hot flashes and dry vagina and no libido. Menopause just means menses pause. Your menstruation pauses. Your period stops, right? So if you have endometriosis, if you have cramping, if you feel like you're bleeding to death, if you have polycystic ovarian syndrome, if you have horrible cramps, if you're suffering from infertility, if you have PMS and you turn to if you turn into a bitch on wheels, if you have breast tenderness, if you have symptoms, if you have female symptoms, all that we have to do, and sometimes it sounds too simple for women, and they're like, that's all you have to do. Well, I don't want to say all you have to do, because I guess that kind of invalidates your misery. But what we do in quantum nutrition testing is we help identify the cause. If we can find the cause, then we can help handle the cause. We can help rebalance the body. And so, say you've had a crappy period for, I don't know, 20 years, it's probably going to take us longer than a month to get that rebalanced, right? We have to be realistic. But we can work towards it. So I've had women with like cramps from hell, and they have to stay home, and now they can go to work. I have women with nasty fibroids. So I had a patient case, she had a basketball size fibroid, and we were able to shrink the fibroid. We didn't do it, her body did it. How did her body do it? We looked for the cause, and we handled the cause. We've had women with nasty cysts, right? PCOS. And so we look to see what the imbalance is. We do not balance it by giving chemicals. We don't balance it by cutting out the ovaries. We don't balance it by removing the uterus. That doesn't balance it. That removes it. And oh, by the way, when you remove your ovaries and your uterus, the rest of the structures in there get messed up. And so bladders like to fall down. I have women that come in with prolapsed bladders. It means the bladder has fallen down and it's not working properly. So they're getting chronic urinary tract infections. They're bleeding. They're miserable. I had one lady come to me. Her bladder fell down, prolapsed. She went to her doc. Her doc decided she should have a procedure where they staple the bladder back on one of the walls. It fell back down. And she comes to me. This is the first case I had like this, by the way. It was probably, I don't know, 7 years ago. And she goes, what do you do for that? I'm like, I don't know. Like, your bladder's falling down. That's pretty horrible. And I tested her. And we found out that her structures needed more support. And so she actually tested for a product called collagen C from Standard Process. So now, if you have bladder problems, it doesn't mean, if you're prolapsing organs, it doesn't mean everybody who takes collagen C that will fix them. We quantum tested her, we nutrition tested at the time what she needed. She needed collagen C. It was a supplement. She needed 3 tablets. It was not a big deal. She started taking the collagen C, and she said, hey, Dr. Palmer, do you think this will help me? I said, well, right now you already had your bladder tacked up. It fell back down. That didn't work. It's not going to hurt you. Collagen helps support structures. So she started taking these nutritional supplements. And I'm not saying I treated her, I cured her, or anything like that. I'm just saying I gave her body some nutrients, and her bladder sucked backed up and reformulated, restructured itself, repaired itself. Remember, your organs and glands remake themselves. We have in our bones, we have these things called osteoblasts. They rebuild bone. It happens throughout your whole lifetime. We have these things called osteoclasts. Osteoclasts tear down bone. Your bone is constantly rebuilding itself. Every 120 days, you have new red blood cells. Every 7 years, your body regenerates new lung tissue, right? So garbage in, garbage out, right? If you are feeding your body crap, if your favorite food comes from a window and that's all you eat is garbage, you are rebuilding your body with garbage. You can think about it in building a house. When you want to build a house, you want to build your house with great, strong materials, high quality materials, right? You don't want to build your house with cardboard or Chinese drywall. Remember when Chinese drywall came out? I'll probably get this video tagged for saying Chinese. But yeah, so Chinese drywall had a lot of issues. It had chemical off-gassing. So you don't want to build your body with crappy food, or you will have a crappy body. You will have problems with endo. You will have PCOS. You will have PMS. Some of you guys are suffering because you put too much chemicals in your system. You spray perfume all over your thyroid. I used to. I loved Romance by Ralph Lauren. When I was in my 20s, I'd spray my thyroid with that. I'd spray my wrist with that. Hi, Tati. Hi, Jessica. And then I wondered why later in life I had problems with my thyroid. I sprayed chemicals on my thyroid for years, thinking I smelled pretty, right? Like how many women, how many of you guys spray chemicals on your thyroid? How many how many of you I used to put plugins in, right? I thought plugins smelled good. My massage therapist at the time was like, "Oh my gosh, I love like the cinnamon plugin or the fall plugin or the pumpkin spice plugin," and we would put them in all the office because we thought they smelled good. What are they made out of? They're made out of chemicals. What do those chemicals do? They are toxins for the thyroid and other body parts. So Galliana says she used to. Yeah, Jessica has a air freshener in her at her work in the bathroom. So when you have toxins, toxins get into your system. They get stored in fat tissue. A lot of women store toxins in their uterus. That's why, ladies, you feel better when you're pregnant because the toxins are coming out of your uterus and going into other places. I'll try to be nice on this webinar or Facebook Live or whatever you want to call it. So that's why I want to let you guys know, if you know someone who is suffering with female issues, we can help them. If you know someone who is having male hormonal issues, high estrogen in a male is no bueno. They start getting man boobs. They start losing muscle mass. They start getting kind of plump. Men with low testosterone, there's a reason why they have low testosterone. A lot of times it's because they have very high cortisol. What does that mean? Cortisol is a stress hormone. So you have high cortisol, other hormones will go down. How do you get high cortisol? Well, maybe you have a stressful job. Maybe you work in an environment where people are trying to attack you verbally, attack you physically. Maybe you have a jerk boss. Maybe you are in a high pressure industry. Maybe you have a mean coworker. Maybe you're understaffed, right? So we've been understaffed for too long. We just hired an awesome person to help us at the front, just interviewed an awesome person to help us in the front. So help is coming. So just know, if you're one of my patients, I apologize. We're understaffed, so we're doing the best we can, but we don't have enough people helping us. Yeah, so stress will increase cortisol in a female and mess up your female cycles. Stress will increase cortisol in a male body and mess up male hormones. That is one of the hardest things to handle. So we do have supplementation that can help naturally rebalance the body, right? Give the body nutrients, give the body vitamins, give the body minerals, right? The hardest part of my job, I don't know, is it the hardest part? A hard part of my job, or a challenging part of my job, is to take people that are extremely stressed out over government, over governors, over elections, over presidents, over pandemics, over kids, over marriages, over spouses, over whatever, and decrease their stress hormones. So if you need our help, we are here for you at Palmer Natural Health. We can help you locally. We can help you virtually via telehealth. Right now, we launched our Black Friday special. It is crazy. When I approved the special, I was like, really? That's what we're going to do for Black Friday? Okay. And meaning, like, what we do is so powerful. Meaning, a lot of times we're the first time someone was giving an answer to the cause of their problems. We get crazy cases from university hospitals, from the Mayo Clinic, from other countries, where that person in another country has seen so many different medical doctors, so many different specialists with no answer. A lot of times we're people's last hope and a last chance for help. And I don't want to be their last hope. And so for Black Friday, starting today, well, no one's at the office now, but I guess so starting tomorrow, or you can private message us for 99 bucks. 99 bucks, we will do your consult. We will get on the phone with you. We will ask about your family history. We will ask about your health history. We will ask about your dental history. We'll ask about your shot history. We'll ask about your environmental exposures. Were things sprayed in your environment that you inhaled? Were you exposed to mold? Were you exposed to radiation? Were you exposed to asbestos? Did you have on the job risks? Dentists and dental hygienists are exposed to certain chemicals. Certain jobs have higher stress levels. We'll dig deep and ask you questions about for a half hour or so. We're going to take that data and we're going to quantum nutrition test to see what is the cause of the problem. Is it from a toxic chemical? Is it from a toxic metal? Is it from mold exposure and you got mold illness? Is it from breast implant illness? Some ladies don't want to hear that their breast implants are toxic. Yes, all breast implants are toxic and they're not supposed to be in your body for forever. They need to be replaced. Don't get mad at me. Don't shoot the messenger. So many women that I know or become patients, they were doing okay with their health. They get breast implants and now they feel like dog poop. We look for parasites. We look for causes of why you have symptoms, causes for why you're tired, why you have hormonal issues, why you get grumpy, why your hair's falling out. Then we take all that data, we put together a report. If you are a virtual person, we send that report to you. We get on the phone with you, we explain all the findings. If you are local or if you fly in to see us, we hand you the report. And then in person, we go over the report with you and we tell you what we find. We tell you if we can help you. If we can't help you, we will be very upfront and say, this is not an office for you. This is not a case for you. We can't help you. Usually, if we're saying that, it's because you're on some really, really, really toxic medications. Maybe you're doing chemo, maybe you're doing radiation, maybe you're in a really bad shape and we don't feel like we're the right office for you. Most cases, though, if they have some chronic conditions, we can help them as long as they're willing to do what we need them to do to get better. What does that entail? Asking you to do your follow-up visits, which are usually weekly, which usually last around 10 minutes. Ask you to take supplements, ask you to make changes in your lifestyle, which may include food, exercise, sleep, and stress reduction. If you're willing to do those things, we're willing to hold your hand in person or virtually and pull you through and push you through and coach you on how to get better. So if you are interested in the Black Friday deal, you can just private message the office. You can call the office at 407-682-8444. It is after hours now, so we're not on there. And I don't believe that Erin is in the background answering us. If she is, you can private message her as well. All right, guys. Well, hopefully that was helpful information. Hopefully you've learned something tonight. If you feel this information was beneficial, feel free to share it with a friend. I would love to help them. I'm Dr. Lisa Palmer. I'm the head practitioner at Palmer Natural Health. I wish you a great night and you don't have to suffer anymore. Good night, everyone. Bye. Bye, Jessica. Bye, Galliana. Bye, Tati. Bye, Jamie. Bye, Tamika. Hi, Tamika. Bye, Tamika. Hi, Donna. You're welcome. Bye, everyone.